Hi everybody, I am Dr. Victor Menezes from Mithi Surgery Hospital, Mysore. I have done my MBBS from St. John's Medical College, Bangalore, MS from Tata Memorial Hospital and KEM Hospital, Bombay. I have done my FRCS degree and worked for 3.5 years in London. Also from National Law School, Bangalore, I have done postgraduate diploma in medico legal studies and ethics. Today we will discuss regarding piles and laser treatment. As you see, this is a picture of normal anal passage. Everybody will have few blood vessels as cushions in the lower part of the anus region. When these cushions increase in size, this is grade 1. When they increase and stay within the anal passage, this is grade 2. And when they increase, every time we defecate, the piles mass comes out, but it goes spontaneously, that is grade 3. And in the last stage, that is grade 4, the pile mass is so big, it comes, get entrapped and becomes very swollen, very painful, and also blood vessel thrombosis can happen, ulcer can happen, and even gangrene can happen. What is the reason for piles? The most common reason is constipation. As we see, present generation spends a lot of time using mobile in the toilet, and also they like junk food which is very low fiber diet such as pizza, bread, aerated drinks. Piles is common in pregnancy as well as after childbirth, and also in obese people and weightlifting people. But most important is hereditary. It can be seen many family members in the same family. What is the most common problem with the piles? Most commonly what we get is bleeding, and is a fresh bleeding. In the grade 1 and grade 2 usually is few drops, but grade 3 and grade 4 it can be much more even during the defecation as well as after. Since there are a lot of mucus glands in this area, when we have piles, the mucus increases and there is itching. Why is it important to go to a surgeon and get it examined and treat? Number one is to diagnose correctly. Many people think the bleeding from the anal passage is only one reason, that is piles. No. There are inflammatory bowel disease, even there is cancer chances, and hence better to go to a doctor and have a finger examination of the anal passage, light tube examination of the anal passage, and if the doctor has got any doubt, he may suggest colonoscopy to rule out other diseases. This is a picture we see in the OPD where grade 2 piles are seen. This is the grade 4 piles. As I said, they have come out, got swollen, and some have got ulcers, some have got gangrene. What can we do for the piles? The first thing we can do is increase the high fiber diet. That is by taking green leaves, vegetables, nuts, sprouts, and increase the liquid diet. And second most important thing is to make the habit of going to the toilet every day at the same time, and this is very important. What we earlier used to do is in open surgery, we used to cut open and remove the blood vessels and then put the stitch and leave the wounds. Now what we do, other option is cryotherapy, in which very cold nitrous oxide gas is supplied through a probe to the piles mass. What is the problem in this? This also damages the lining membrane of the anal passage as well as the tissues in and around the piles, and hence patient have increased mucus discharge throughout life. Today we are going to learn what is laser. As you know, on the radio at different wavelength we listen to different stations. Similarly, the light has got different wavelengths, and this particular medical device gets 1470 nanometer energy into this fiber, and at the tip you can see the red light. From there the energy will be released when I press this foot pedal. This laser energy is going to act on the blood vessels by either water or blood effect, and it makes the blood vessel shrink. That's why it can be used in various treatments of piles, varicose veins, fissures, fistula and sinuses. Laser energy is extremely safe. The reason being, this laser energy has got effect for only 4 millimeter from the tip, and hence there is no damage to the surrounding structures, and hence there are no side effects. It is so safe that it can be used even in pregnancy and children. And as you see, now we are getting ready for the laser treatment, and this is the laser mask you can see here, and as we explained, this is the laser fiber which delivers the laser energy. It's got a probe. While doing, this probe goes into the laser mask and laser energy is released and the entire laser mask shrinks. In laser, we almost see no pain, and the patient returns home the same day, can return to work at the earliest. Whereas you see in cryo, it could be 4 to 7, whereas in the open surgery method, it is almost 8 to 10 and also lasts for 5 to 6 weeks time. What are the advantages of laser treatment? Laser treatment is very safe because it gives the effect to only 4 millimeters surrounding the fiber. So there is no side effect for surrounding areas. This can be safely used even pregnancy and children. Since there is no pain, patient will return home immediately few hours after the treatment. He can return back to his studies or work at the earliest next day, and there is no wound, there is no bleeding, there is no chance of infection, and very safe, and indirectly you will be spending much less money since you will return to work at the earliest. This is very safe and has got the highest success rate compared to all other treatments. There is no need for you to come back to the hospital. I hardly see any patient coming for a revisit. Today you have listened all the information which was possible to give you, and hope it is very helpful. Any of you have any of these problems, need treatment or need further information, kindly contact. I am Dr. Victor Benezes from Mithi Surgery Hospital, Mysore. Thank you for watching, and any of you need any further information, kindly contact this center.